So my name's Adrian Hayter. I'm a GP by background, and I was one of the system leaders at the beginning of the Frimley Health and Care System. So one of the kind of founding kind of system leaders in that system. I'm the National Clinical Director for Older People and Integrated Person-Centred Care at NHS England. So so great to be with you all. I've just been actually I've been helping my mum clear her house out, and we've just got rid of a whole box of Encyclopedia Britannicas, so I can recognise the old technology. Really, Richard, in terms of the one thing that I would do, I think when organisations and systems are creating their strategy, they put a lot of effort into having that communication and engagement with partnerships across. And I think for system strategy, I think it's really important that that dialogue really continues, and it's an ongoing dialogue, because those communities that are going to be there and at the end of those strategies will be the communities that we really want to continue to listen to as the strategic plan is kind of played out. So my thing that I would always do is to just continue listening and talking to those communities and the organisations around them. And then the thing I would avoid, and I think this is kind of goes to the heart of how kind of systems are being kind of set up, and the opportunities for integrated care systems in the future, is about kind of resisting that temptation, as you might do within an organisation sometimes, to have a much more hierarchical kind of governance relationship, where you would have a small number of people at the top making decisions, because that can sometimes then railroad how your strategy is kind of panning out. And I think that that for me is the need to create some of that subsidiarity, some of that kind of on the ground kind of arrangements for people to know their communities and to be allowed to deliver across for those communities. And I think as we go forward over the next few years, I think that that's going to become much more important, and it goes beyond kind of a co-production. It's actually kind of, you know, a real partnership across within organisations and with communities.